Okay. Hello. We are here to do our informal debate on the topic of health versus in-home ABA therapy. For our group, myself, Jessica, and I will be working as the introducer and then fielding some questions at the end of our debate. We also have Raina, who will be providing some summarizing information and illustrations for the in-home therapy. We also have Megan, who will be providing research for in-home ABA, and then illustrations to support tele-ABA. And then we have Shabna, who will be summarizing for telehealth, and Lindsay, who will also be providing research then for telehealth. As we go through this debate, each side will point out the strengths and weaknesses of their position. We'll be also pointing out some ethical codes that support each side, and some that the other position may be violating. So we'll go ahead and get started with in-home therapy. So up first, we have Raina with some summarizing.
Hi. So our first question is why there is a debate. There is a debate when it comes to in-home therapy because many believe that ABA therapy should occur across a wide variety of settings instead of just in-home. But there's like little to no understanding of the impact the child diagnosis has on their siblings, parents, and others. The diagnosis is never something easy for parents to take in, and one could only imagine how hard it must be on the family. And home therapy has its benefits that many are not aware of. As you know, ABA therapy can occur in clinic, schools, and in home. Many don't like the idea of in-home therapy because they think the child will lack the ability to generalize different situations and environments. So next, we are going to describe in-home services. In-home therapy is described as the implementation of applied behavior analysts for children who are diagnosed with ASD, also known as autism spectrum disorder. But instead of being just clinic or center-based, the therapy is done within the child's home. ABA's overall goal, especially within the home, is to increase wanted behavior, and we also want to decrease unwanted behavior. In-home services largely assist with really important skills such as getting dressed, toilet training, and different routines such as bedtime routines. Sessions usually occur in an area where there are minimal distractions, so siblings and pets and whoever else shouldn't be present in the environment. So next, we're starting with the pros of in-home services. There are many pros of in-home services. A study conducted by Cibula in 2012 has found that there's been an increase in positive interactions between siblings and the child with the diagnosis of ASD. Having sessions in home is a great way to get siblings and parents involved in different social programs such as sharing or peer interaction. Not only does this benefit the client, but it works in the favor of the client's siblings. So there's a positive impact on both parties. Another pro is that home-based therapy allows therapists to conduct session in everyday situations such as going to the grocery store, dinner time, bath time, and more. From the experience I have had as an in-home therapist, taking a walk outside or going to the grocery store is a great way to generalize different items. For example, I had a client I used to take outside for a walk 3 times a week. So each time we went for our walk, we would tack different items. Tacking is also known as labeling or identifying. So we would identify items such as cars, flowers, animals, and this was a great way to generalize different objects. Another pro is that in-home therapy is a great way to correct any problematic behaviors that are occurring within the home setting when the therapists aren't there. So an example would be if a child has an attachment issue to their mom, which I've experienced as a therapist, moving session to a completely different area in the house would somewhat break that attachment because mom is nowhere to be found. And there are other problematic behaviors that may occur, and for the therapist to be there and be able to track the behavior using something called an ABC data chart is a great way to find the function of the behavior. Another pro is actually, according to a study conducted by Dixon in 2016, parents are more likely to participate in treatment sessions if they're held in home. Many parents can't participate in sessions like within clinics and centers due to client confidentiality purposes. So I worked in a clinic where parents weren't allowed in the back because of other clients, and that like conflicted with confidentiality issues. Parents also have a hard time participating due to jobs and other children they have to care for. So being in home is a lot more convenient for them. Not only is in-home therapy more convenient, but it's also beneficial for lower income families. Lower income families may have difficulty with transportation, and in-home therapists are a huge asset because they are able to travel from home to home. It makes it easier on the families that are lower income families that have no transportation and have larger families they need to take care of. Not, oh, I'm sorry. Last but not least, parents can be assisted in behaviors such as tantrums that are occurring within the home. They're also able to learn different techniques from the therapist being there when these behaviors are occurring. For example, a client is throwing a tantrum because he wants to play rather than eat his dinner. Instead of the parents giving in and letting him go, they could ask the therapist, what could I do to prevent this? Or how could I assist within the situation? So the therapist could advise them to give the child a certain amount to eat, like such as a little goal for them. And once they finish that amount of food, they can go play instead of just giving in to their behavior. If not, they could leave the child at the table until the demand is followed through and the child eats their portion of food. Simple things like this will make a big difference at home for parents. In regards to the ethical code supporting these pros, one in particular is code 2.09, which is treatment/intervention efficacy, which states clients have the right to effective treatment. Behavior analysts have the responsibility to advocate for the appropriate amount and level of services. Additional factors may be considered in selecting interventions, including but not limited to efficiency and cost effectiveness, risks, side effects of the intervention, client preference, and practitioner experience and training. And behavior analysts review and appraise the effects of any treatment that may have an impact on the client's goals. The other code that supports these pros is code 4.07, environmental conditions that interfere with implementation, which states that if environmental conditions prevent implementation of a behavior change program, behavior analysts can seek out other professional assistance. And it also states that if environmental conditions hinder implementation of the behavior change program, behavior analysts seek to eliminate any environmental constraints. Overall, the pros of in-home therapy outweigh the cons in a number of ways. Hopefully, parents will see that being in home is actually beneficial to their children.
Okay. Oh, sorry, go ahead. Okay, thanks. So next we will have some research supporting these pros to in-home therapy. So we have Megan up next.
Okay. Hello, everyone. My name is Megan, and I'll be sharing some articles that provide support on the in-home methods of ABA. So as Raina just mentioned, a notion that has recently been brought forth mentions the support of in-home ABA in regards to the effect it has between the child receiving the therapy and the surrounding family members in the home. This particular notion revolving around in-home ABA therapy and surrounding family members is becoming a desirable trait when deciding upon a setting in which therapy is going to be received. So in Sebula's 2012 article, the benefits of positive pro-social adjustments between family members of a child with autism linked to services of ABA in the home are studied. The study consisted of 132 families receiving in-home services for their child with autism, with a control group that was receiving services that were not ABA. The study provided additional arguments in favor of in-home ABA by linking in-home services to behavioral adjustment between the child, increases in sibling relationship quality, and decreases in negative interactions between a child with autism and their siblings when compared to the control group. A limitation to this article was the belief that some of the siblings in the study had already been interacting positively with their siblings before the intervention. And in addition, there was some belief that in-home ABA could be beneficial for some siblings, but not all. So future implications could focus on long-term effects of in-home therapy sessions rather than the familial relationship. The second article I'll be sharing is by Grindle, Kovshoff, Hastings, and Remington, 2008. They study the form of ABA known as Early Intensive Behavioral Intervention or EIBI, with regards to the family involved. The participants in the study included families with children receiving at-home therapy for over 2 years. The 53 parents that were interviewed in this study reported findings of significant improvements in language, social skills, and play skills in their children. And they also reported more time for daily tasks for themselves and assistance in home support with in-home support for their child during challenging behaviors, as Raina also mentioned. A third finding was that parents reported success in learning effective behavior management skills for their child in the home. And lastly, it was noted that siblings enjoyed learning about autism through initiation in therapy sessions and observations of interactions between the child, their sibling, and the therapist. It is noted that this study analyzes the effects of EIBI on parents and siblings, but not the child receiving the therapy. So further implications could focus on the specific relationship between the effectiveness of in-home services and the child's personal perceptions. And Article 3 by Dixon in 2017 is the third and final study I'll be sharing in regards to in-home ABA therapy. Dixon argumentatively presents us with the belief that intervention settings can influence the rates of learning for children in treatment. Results of the study do indicate that a clinic-based location does guarantee greater amounts of learning, but there are limitations. The study fails to examine the comparison of in-home and clinic-based settings of various ABA services, being the sole focus is the CARD model. So future research could compare the settings of ABA using alternative models of ABA like EIBI or TEACH, as well as services in a different school or agency.
Okay, thanks, Megan. So next we have Raina. Again, she will be presenting some illustrations to help support in home.
So as you can see, Table 4 from Parents' Experience of Home-Based Applied Behavior Analyst Programs for Young Children with Autism. The chart provides an impact of EIBI, which is also known as Early Intensive Behavioral Intervention, on family relationships. To the left, you could see the different topics/categories. So we have parent-child relationship improved, child could communicate more, child became more affectionate, sibling-child relationship improved, parent-sibling relationship improved, parent-sibling relationship deteriorated, and parent relationship deteriorated. So as you can see, parent-child relationship showed the most improvement, and 100% of mothers and fathers agreed to that as well. A large percentage of parents also agreed that the child was able to communicate more, along with seeing an improvement in sibling and child relationship. And to the right, you could see there are examples of like how they might have improved. So for example, for the parent-child relationship, both parents agreed, and it says, the example states that I think he has a really great relationship with me. His mother, which I really don't think he would have if he had stayed at school. I would have been the person who picked him up, took him home, and put him to bed, whereas I think it had helped for us to bond together. And there are many other examples that relate to the different topics/categories. Now, Table 6. Table 6 from Parents' Experiences of Home-Based Applied Behavior Analyst Programs for Young Children with Autism provides the overall evaluation of EIBI, which is also known as Early Intensive Behavioral Intervention. To the left, this is similar format to Table 4. It has the topic/categories, and this one states whether EIBI was the right choice for the child and the family, and 75% of mothers and 90% of fathers agreed that EIBI was the right choice for their child and their family. A very small percentage shows that mothers and fathers agreed that EIBI was the right choice for the child, but family life just happened to be affected by it. A large percentage of mothers and fathers believed that EIBI was beneficial and they would recommend it to other families. Last but not least, 19% of mothers and 29% of fathers would recommend EIBI, but would warn about the negative impacts on family life. Also, this being the same format, there are examples of statements parents had to say about each topic/category. So overall, these visuals were selected to show that early interventions, especially being in home, do have an impact on families. And we also wanted to we also wanted to provide an overall evaluation of early interventions and the effectiveness it has when completed in home.
Okay, so that concludes our section on in-home therapy. So next we'll be talking about the telehealth ABA. So first up we have Shabna, who will be summarizing some of those pros for us.
Hello. So while face-to-face services may be ideal, this is not always achievable in real-world settings. One obstacle is that services may be expensive for families who have to take into account things such as travel accommodations and related expenses. Some examples of this would be rooming, food, method of travel, whether it be taxi, train, plane, or bus, in addition to any actual service fees that they will have to also pay. Furthermore, clients in small towns may not have access to specialists, or if they are attainable, the fees may not be. On the practitioner or specialist end, face-to-face services can also limit the amount of clients that a BCBA can actually serve. There are also so many hours within a day that one can actually provide therapy. With face-to-face services, practitioners, much like their clients that they serve, also have to take into account things such as travel and time expenses that are needed for direct observation. Therefore, telehealth ABA services actually may prove to be more beneficial. What are telehealth ABA services? Well, they describe the use of two-way audio-visual transmission of data using desktop video conferencing and broadband internet, and that was found by Michilasek, 2016. Telehealth ABA, therefore, is the implementation of ABA trainings and procedures via technology. Telehealth services have been used to implement with success trainings, assessments, behavioral procedures, and also parent trainings. There are several pros to telehealth ABA. One is that it is cost-effective for both providers and families. Wacker, 2013, found that on average, costs for telehealth treatment versus costs for face-to-face treatment were around $11,000 and $55,000 respectively. This is a huge difference in cost. Special needs families spend a lot of money on various tests and services, and every penny that can be saved means more money that the family can utilize in some different way. They can possibly invest in a different service, different assessment, or they can use it for themselves for some much needed family time. In regards to practitioners, they also have to take into account travel expenses, as well as the time that it takes to go from service to client and provide services. They often have to scramble from appointment to appointment, gathering their materials, and this all wastes time. While with telehealth services, practitioners can actually provide quality training and therapy from their own office. They can still make changes to programs in real time. They can oversee the implementation of a variety of lessons, and the reduction in time travel allows for more treatment and more clients that are able to be served. The reduction in travel time. Telehealth services also meet the issue of need versus demand. So Wacker 2013 also found that the demand for behavior analyst services often far exceeds the availability for these services, even with the application of procedures to home and outpatient and clinic settings. There's also this also meets the need of accessibility and specialist shortages. Michilasek also furthered this idea by finding that those in rural communities often have difficulties finding services. Telehealth ABA makes it so that those that are living far off in these rural communities, as well as areas that have just a shortage of practitioners, are still able to access these services. Lastly, Tomlinson, Gore, and McGill 2018 found that telehealth services can reduce travel-related costs, make scheduling appointments easier, and even increase family caregiver participation in interventions. And as we know, caregiver intervention and participation is incredibly vital when it comes to providing ABA services. After all, it's them who are to take over the support as we begin to fade our support away. With telehealth services, there is a reduced pressure for the caregiver who may feel uncomfortable with the presence of somebody in their home just watching them. In an in-person observation, among other things, the caregivers have to make sure that their space is presentable at all times. Whereas with video technology, it is far less intrusive. In terms of feedback, some may also find it easier to receive feedback that is via a video service, a FaceTime application, rather than in person. It was also found by Michilasek in 2016 that telehealth ABA can be used when long-term assistance is needed during naturally occurring routines. So practitioners can provide long-term feedback, for example, with a sleep program, without necessarily having to camp out at a client's home. There are a few codes that support telehealth ABA, one of which is Ethic Code 2.11. This one states that behavior analysts create, maintain, disseminate, store, retain, and dispose of records and data relating to their research, past practice, and other work in accordance with applicable laws, regulations, and policies in a manner that permits compliance with the requirements of this. So this basically means that for a behavior analyst to provide such regularly and timely oversight, it seems that they would need to be easily accessible to their clients and vice versa. Telehealth services allows for this. No matter what distance, the practitioner can be there for their client and their families. Practitioners are able to easily track and monitor client progress from their own office and store data in all in one location, which is going to allow for protection of those PHI forms, that personal health information. The last code that supports telehealth ABA is code 4.0. This one states that behavior analysts are responsible for all aspects of behavior change programs, from conceptualization to implementation and ultimately to discontinuation. For this to happen again, the behavior analyst needs to be able to review treatment implementation and progress in real time, or as close to real time as possible. With telehealth services, practitioners are able to do this and ensure that their clients are receiving the best possible treatment without delay and in a way that is ethically appropriate. Thank you.
Okay, thanks for that information. So next we'll have Lindsay, who will be providing some research to help support telehealth.
Okay. Hi, I'm Lindsay. The first article I will be discussing is called Communication Intervention for Young Children with Severe Neurodevelopmental Disabilities via Telehealth by Simasek, Demian, and McComas in 2017. So the purpose of this article was to examine the efficacy of parent-implemented communication assessment and intervention via the use of telehealth coaching. A functional assessment was created to determine potential communicative contexts. Then functional communication training, abbreviated FCT, was taught to the 3 clients in the study. The treatment implementation was then applied to the previously identified context, and an ABAB design was used for one of the contexts to further prove validity of the study. And the results of this study supported the use of telehealth services for parent coaching. There were some limitations to this article. and they were related to limited control of telehealth service delivery for 2 of the participants in this study, whose names were Lily and Ella. Generalizability, high level of participant involvement required, and the lack of maintenance data. A child or adult with more severe motor impairments may have experienced more difficulty with the augmentative and alternative communication. So it's AAC for short, that was used in the article. So these children may experience more difficulty with the AAC responses. Also, another limitation was high level of parent involvement for the study. So during the interventions, one parent served as the interventionist as the other parent assisted with siblings. If the parent had to serve as an interventionist without assistance, it might have made implementing the procedures more difficult. And then the last limitation of the article was if the lasting effects of the intervention were unknown, since there wasn't any maintenance data collected. The second article I will be talking about, it's called Behavioral Telehealth Consultation with Families of Children with Autism Spectrum Disorder by Machilisek in 2016. So the purpose of this article was to determine the effectiveness of a telehealth model to address behavioral concerns of clients with autism. Telehealth services were used to assess ongoing behavior, deliver parent education, and provide performance feedback in implementing strategies. So the researchers wanted to see if parent implementation resulted in decreased challenging behaviors in the 3 participants in the study. A multi-element design was used to see effects of intervention on behavior, and an A/B design was used to evaluate parent education procedures. So the results showed that telehealth services could be used to conduct a functional behavior interview and coach parents in implementing a functional analysis, or an FA for short. And this was just a quote from the results in the article, and it says, overall results of the brief multi-element treatment comparison seem to indicate that the intervention strategies derived from the functional analysis were effective in decreasing challenging behavior. These findings validate the functional analysis and provide support for the use of telehealth to facilitate parent involvement in the assessment treatment of challenging behavior. And there are 2 limitations of the research in this article. The first limitation is the behavior consultant, the BCBA, with a PhD in special education, was diagnosed with autism. And a master's level clinician is both more likely and cost effective in a clinical setting. And then this second and last limitation is that the number of functional analysis conditions required to obtain a clear pattern of challenging behavior between conditions was larger than it would have been necessary if an expert clinician had implemented the FA conditions. And for future research of this article, we should evaluate the effectiveness of the telehealth behavioral consultation on parent behavior using a more rigorous design. So for the third article, it is called Training Individuals to Implement Applied Behavior Analytic Procedures via Telehealth. It's a systematic review of the literature. So this article summarizes literature from 20 different articles in support of telehealth. Some common characteristics across trainer and client outcomes were explained, as well as skills targeted and some setbacks. The results discussed that telehealth has the potential to improve the reach and scope of those providing ABA services. So the articles included in this systematic review were most commonly rated as weak or just borderline adequate on the evaluative method, indicating that they lacked methodological quality. The majority of the research in the review was conducted by research teams located in the United States, and in future research should be conducted by other countries rather than only in the United States. Also, more research needs to be done to compare telehealth training to in-person methodology. And the variable results relating to the trainee fidelity warrant further study to identify the determinants of and ways to improve trainees' implementation of techniques and the impact of this on client outcomes. And there were also some technical difficulties in the studies, suggesting a need to document and refine the technological requirements for successful telehealth interventions. This is a common concern for telehealth interventions, and we would need more demonstrations of sufficient technology to conduct telehealth if practitioners are going to use telehealth in their practice. And that is the last article. Thank you.
Okay. All right. So up next, we have Megan again, who is doing illustrating for this. So she will provide some information that'll support telehealth as well.
Okay. So I'll be providing a couple of visual representations correlating to the support of tele-ABA. The Simachek, Dimian, and McComas 2017 study provides viewers with a visual representation of the ABA-B design in which the 3 children responded to the FCT via telehealth. Parents were taught the procedures in order to initiate and strengthen augmentative and alternative communication tools as a means of functional communication. So as you can see, during baseline and intervention, the results were improved after intervention for all 3 children. The baseline conditions demonstrate higher levels of idiosyncratic communicative attempts, which are represented by the black line. Following baseline, intervention methods were conducted by means of differential reinforcement of alternative behaviors. The intervention phases indicate rises in response to augmentative alternative communication system, being that reinforcement was withheld for idiosyncratic responses. Therefore, some support is given towards telehealth coaching parents on delivering functional communication interventions with their children. And next, I'll be sharing the Machilachek 2016 study. So in this study, we're able to analyze the results of tele-ABA that were used incorporating the intervention methods of functional communication training, antecedent manipulation strategy, and consequence-based strategy for Lily, Logan, and Emma. The graph represents a comparison of the 3 participants receiving the tele-ABA in this study, all conducted via parent implementation. Lily's graph indicates any challenging behavior during antecedent manipulation and functional communication were at low levels, and there were no occurrences of challenging behaviors during the differential reinforcement phase. Logan's graph indicates that challenging behavior occurred at low levels during all 3 of his intervention phases, being antecedent strategies, functional communication training, and differential reinforcement. Emma's graph represents complete success, being that challenging behaviors did not occur throughout any of the 3 intervention phases. According to the information provided on this graph, challenging behaviors were noticeably decreasing or eliminated due to the effects of intervention strategies implemented through telehealth. Therefore, the results and information provided in this specific study support the use of telehealth video conferencing to assess and treat challenging behaviors. And that was the last visual representation.
All right. So that concludes the debate portion of our video here. I just wanted to add a couple points about telehealth and in-home, and then I'll pull some questions that were given to us by the professor, and we have group members who will be answering those questions as well. So first, some questions that people may have about this topic are what kinds of behaviors you should work on with the different methods of therapy. So you want to be really careful when you consider what behavior is going to be worked on in a setting. Aggressive, dangerous behaviors probably should be worked on in home when a actual expert can be there to interject themselves as needed. You don't want to have a parent on the other end of your computer who all of a sudden has a child that begins lashing out and throwing items around the room and they don't know how to stop them. And you also don't want to reinforce any behaviors, accidentally through that. So just be careful when picking what types of behaviors you want to work in each setting. Another thing that I just thought of was the cost of equipment that goes into the telehealth. So overall, the cost can be lower because you can divide up clinic time and space and all that. But you may have to provide families with some equipment. Most families nowadays, they have a laptop or a computer, they have access to those kinds of things. So it shouldn't be too difficult, but just something else to consider as well. So on to the questions from our professor. The first question will be read and answered by Lindsay. Lindsay, can you unmute your mic?
Sorry, yes. Okay, so the first question is ethical responsibility when dealing with a client's preference in regards to the use of tele-ABA. So an ethical concern using tele-ABA services are HIPAA concerns to protect clients' personal information. Tele-ABA requires that clients have safeguards on their computer to be sure that clients' privacy and personal information are safe. A virtual private network will also help protect the privacy of the client's information. And it's VPN for short. VPN helps protect data, confidentiality, and integrity. Also, when providing informed consent, clients should be informed the difference between tele-ABA and face-to-face ABA. Clients should also be informed about the risks and benefits associated with tele-ABA. And that's it.
Okay, thanks, Lindsay. Okay, so next we have our next question will be answered by Shamna.
So number 2 was what confidentiality issues might arise when providing either in-home or tele-ABA therapy, and how should these be addressed? In tele-ABA, some of the biggest issues that may arise are internet safety. While there are many security advances on the internet, the possibility of information being taken is still possible. Practitioners should never release information to any source that they are unsure of, and they should also ensure that they're using a safe network in a non-public location while they're providing such services. Another thing to help address this issue would be to ensure that the families are aware of this possible threat and provide them with any documentation necessary regarding personal health information. And for in-home ABA services, confidentiality issues may arise whenever dealing with other members of a client's family, friend circle, and loved ones can often ask questions to practitioners regarding a client's programming, saying how things are going, especially if they're seeing them constantly at the house. This can also occur in settings other than home. On outings, practitioners can be asked random questions by complete strangers sometimes. And again, the best way to address this issue is to make sure that the practitioner is not providing any information to those that don't need it, and by ensuring that the family is aware of the risk and have signed any forms related to personal health information. And that's all.
All right, perfect. So our last question just wants to know if any of us have any personal experience with this. I think we all kind of talked and said this is a pretty new topic, and so I personally don't have any experience working other than in-home in a school setting type things, but I was able to attend our state behavior association conference last month, a few weeks ago anyways, and apparently there have been some studies here in Iowa because we are so rural. It makes a perfect fit for studies on telehealth, and so that was interesting just to hear him talk about those, and then it just reaffirmed a lot of the points that we talked about in our debate presentation. So I will just go down the line here and let everybody chime in on that topic. So Lindsay, you're up first.
I do not have any experience working or doing tele-ABA therapy, just face-to-face therapy, but I would be interested in maybe experiencing tele-ABA services.
Okay, Megan, you're up.
Unfortunately, I do not have personal experience on tele-ABA, being that I have only provided ABA in schools, but I would be very open to and eager to participate in this form of ABA in the future.
Okay. All right, Miss Rena.
I don't have any personal experience with tele-ABA. Usually my therapy is done in center or in school, but I would be willing to try it.
All right, Ms. Shamlin, you're up. There we go.
I have provided myself. I have done. Usually, I do in-person ABA, either in clinic or in home settings. I do know of somebody who has a similar position as I do in an office nearby, who actually does provide tele-ABA for clients that have home sessions that she's not able to overlap directly with. So she'll go ahead and have them FaceTime her in sessions, and she'll do her program updates that way.
Alrighty, so like we kind of mentioned before, not many of us have experience with the telehealth, just because it is kind of a new area for services. But it'll be really interesting to see where it goes from here, and to see what kind of situations they can be used for, behaviors they can be used for. So exciting things happening out there in the world of ABA. So anyways, that concludes our group presentation. We hope you enjoyed it and hope you learned some interesting topics. So all right, thanks. Bye-bye.